I mean, estrogen in males, very important for 8 different major systems in the body.
Please teach them. Please
estrogen.
teach them.
I don't use any aromatase inhibitors.
Thank you. I'm going to scratch that question out.
I don't use Arimidex because what it does is destroys 8 systems in the body. You need estradiol to help keep your area of the brain that gives you your memory, recall, and ability to learn new things, the area called the hippocampus. You need estradiol to stimulate your own production of growth hormone. If you don't have estradiol, you can't make adequate amount of growth hormone in the brain. And then growth hormone and estradiol in the liver turns on the IGF-1, insulin-like growth factor 1. Why is that important? Gives you your guns. Helps you with your guns. It's not just testosterone.
There it is.
Gives you your guns. Also, in my age group of 70 years of age, there's another hormone that's produced. They call it myostatin. Myo for muscle, statin for stop. It stops you from repairing and growing muscle.
Wow.
What counters that? IGF-1. IGF-1 increases protein synthesis. So when you're using aromatase inhibitors, you end up destroying those areas, the protection of the lining of the arteries, protection of the bones, increase in blood flow in the brain, all because of estradiol.
Yeah.
So the question really is, if your estradiol level is high, why? And they say, well, we're using testosterone. Well, maybe your testosterone level for your body is too much. The body has built-in mechanisms for helping the body deal with excessive amounts of certain hormones. If you have excessive amount of testosterone in your system, there are 2 pathways that it has to get rid of it. One of them takes you to estradiol, the other one takes you to something called dihydrotestosterone. DHT. And that's the escape mechanism. So what we do is we use low dose repetitive injections, which we in our practice use low dose every 72 hours. So average it twice a week. They're getting a shot. And what happens, instead of going sky high, which turns on the conversion of estradiol to estradiol and turns on the conversion of testosterone to dihydrotestosterone, we stop that by not spiking the system. And then, as well as deficiency of certain minerals, like zinc deficiency, will give a male more estrogen production than if their zinc levels were great. Also, adequate amount of selenium levels will slow down the conversion of testosterone to dihydrotestosterone. Why don't you want a lot of dihydrotestosterone? Because it causes
hair loss.
Hair loss.
But a lot of people
It
rather
causes
have
acne,
hair.
oily skin. It causes prostate enlargement. It causes shrinking of the gonads. And so too much of DHT will create those problems.
Sorry, and I have to say that because it's funny. So before we met you, the way we ran our practice was so similar to what you're doing. Our blood panel includes 31?
No, like 60
levels?
something.
Biomarkers. It's almost identical.
It's almost
to-
identical except 2.
with what you're doing. When I first started doing testosterone replacement 15 years ago, we had a cookie cutter type of a practice. 1 ml a week.
Right.
AI, anastrozole 0.5 milligram twice a week, HCG the day before your injection.
Right.
Everybody got the same. We need to evolve. There are still some practices still doing this today.
Correct.
You know, we got to learn, we got to understand physiology better. Now we do the same. A typical regimen is every other day,
2 to
3
3
times a week.
Right.
Smaller doses, microdosing. We have guys that take small injections daily because that's what their body allows to. And we do not use anastrozole anymore. We use zinc, we use selenium to help with all this. And I'm going to tell you the typical patient that we see now who comes from other clinic. They come to us, they're like, yeah, you know, I started testosterone therapy maybe a year ago. The first 2-3 months I was okay, now I feel like crap. They're taking 1 ml a week, they take anastrozole, and they're on finasteride.
Yep.
So the 2 metabolites of testosterone that you need, estradiol and DHT, you block them.
Blocking them.
No wonder the patient feels like this.
Absolutely.
Can I, I'm going to throw a monkey wrench at your...
Me?
Yeah.
Oh, okay.
So, no, I just have a question. I'm going to use me personally because I want to go back to what's too high for you personally. So for me, we recently got bone-derived stem cell procedure as a R&D project that we had.
It's working.
And we went under the gun. And, one of the surgeons, when I woke up, the first thing that he told me is like, listen, man, what are you doing? Because I tried to perforate with the device. I couldn't do it. I went with the drill, and I was having a hard time perforating your bone. What are you doing?
He did.
And he could attest to it. And I said, the only thing that I can think of, I was like, well, last time I checked, my estrogen was 120. So when I tell people that, they're like, they freak out when they see 40. So, and also my DHT was super high, yet I still have full head of hair. So do you see, is there like a range that you look for, like where estrogen is too much or too high? Or is there a saturation effect to estrogen?
That's a great question. So I don't follow numbers.
Right, that's what I'm saying.
What I do is I follow symptoms. Okay. So the most common symptom that you can find in a male who, for him, his estradiol level is too high, is you ask him when you put on a t-shirt or put on a pullover shirt, any sensitivity of the nipples? And they say no. So that's it.
There you go.
Because even before you develop the buds, you'll have sensitivity.
Right.
And what I tend to do is to understand how people perceive the higher level of estradiol. I said, do you think you're having any symptoms? And the most common thing they say is, yeah, I'm a little bit more emotional. Okay. Well, to let you understand that what we see in I take care of only veterans, what I see in the veterans is that when they get on our protocol, that their emotionality becomes a little bit exaggerated at the beginning. And that's because they were suppressed from all the drugs they were on.
Right.
So they had flat affect, flat emotionality. So when they're off their drugs and they get onto that, they find that they're reacting to, seeing a commercial with a dog on it,
They can
get
feel
teary
now.
eyed.
They can feel now. They're connected.
So, we're numb. I mean, what it does is, yes, it does improve your emotionality and your ability to connect with the world around you.
For sure.
And I don't.
Well, it's funny you say that because I walk around, always 14% body fat or less, usually 10 to 14%.
Bragging.
I was 9 at one time.
So no, what I like to tell men when I talk to them is like, look, if you're under 50% body fat and you have nipple sensitivity or actual tissue building, then you probably have the gyno gene, which Anthony J in his book detects that you can actually test for it now. Now, if you're fat, diabetic, and you happen to have the nipple sensitivities, maybe you need to lose some weight so you aromatize less because we know it's built inside the fat. So the reason why I said the body fat is because I have to inject 3 times a week or more. Meaning I can't do it twice a week because I start to actually build tissue. I don't even get sensitivity, like actual breast tissue starts to build.
You do.
And then I have to break it down using toxic medications, which after interviewing Shauna Swan and you with the estrogen, I've had to crash my estrogen, block the aromatase enzyme and the receptor by using tamoxifen and an anastrozole just to break it down, right? At this point, I already know what is my limit before I get there. So if you have it, instead of using these Band-Aids is what we call them, then go get checked and get it pulled out. Get the glandular duct fully pulled out so you never have to take these toxic medications for the brain. And talking about toxic medications, something typically that we see that I think is very important for us to talk about is that there are a lot of emerging clinics coming up and using protocols that are very old, or they have, ghost doctors with bodybuilding men leading them using just testosterone, right? And doing once a week and loading people. As my brother always likes to say, a monkey can give you results by injecting you with testosterone, but it doesn't mean that you're going to have a great experience, and you're most likely going to have side effects. So can you talk a little bit about the importance of using testosterone along with DHEA and pregnenolone and why we shouldn't just use testosterone alone, which is what most people are doing and they come to us?
Absolutely. You were dead on when you said about that patient who came and after 3 to 4 months, they felt worse than what they felt at the initiation of treatment. And the reason for that is when you start using testosterone alone, it shuts off 35 hormones in the brain. And those 35 hormones in the brain is what gives us our emotional stability, stops us from being emotionally volatile, angry, irritable, agitated. And that's because when testosterone is used by itself, it shuts off the production from cholesterol of what we call the mother of all hormones called pregnenolone. And pregnenolone is extremely important to be produced, and what produces it is something called LH, or luteinizing hormone. Well, when you use testosterone alone, the body says, wait a second, I normally make luteinizing hormone to generate from cholesterol down the cascade testosterone. Now I've got tons of testosterone, let's shut off that entire mechanism. So you shut off luteinizing hormone, and therefore the body no longer makes its own grouping or cascade hormones. And when you lose some of those hormones like allopregnanolone, pregnenolone, pregnenolone, progesterone, these all help to keep us sane or to be perceived as being, emotionally stable and feeling great. And it usually takes 4 to 6 months for this to occur when you're only on testosterone. So how do you fix it is the question. And with DHEA and pregnenolone. So DHEA, for women, 15 milligrams, for men, 25 to 50 milligrams, depending upon their numerical level. They'll feel the benefits as we go forward, and to be taken at night after dinner, 15 to 30 minutes. Why at night after dinner? Because a side effect of DHEA is that it increases growth hormone production by 10% in males and 15 to 20% in females. So at nighttime you need that, because the peak production of growth hormones between 8 at night and 4 in the morning. And secondarily, the pregnenolone, we give it at night because after food, along with DHEA, because it generates the natural sleep hormone in the brain called GABA. And if you're not sleeping well, you get onto pregnenolone and you sleep like a baby. In our military, the 3 cardinal complaints that they have, besides depression, is the lack of sleep, insomnia, and fatigue. And if you look at their pregnenolone levels, they don't have it. Why? It's the most sensitive for blast trauma, blast wave trauma, whatever form. And therefore, you need to replenish, while you're using testosterone, DHEA, and also pregnenolone.
Very important question that we have to put out there, and we're very cautious because we do use it, but we see that sometimes it could cause agony, including myself.
Correct.
Is it the pregnenolone, the DHEA? Is it the combination? How do we titrate for it?
It's the DHEA, and that's why, we held back a lot on use of DHEA in women, because women are more prone to develop stimulation of their oil glands. So we are now using 15 milligrams every other day, and if after a month they're doing great, we'll go to every day, and if they continue to do well, fine. And if they achieve the levels we need, which are therapeutic levels, not just having a level, but a therapeutic level. Now, what is a therapeutic level? Whatever works for them, okay? Whatever is unique for their biochemistry. So it's not the pregnenolone, but it's the DHEA. And DHT directly stimulates oil glands, the sebaceous glands, and that will cause increase. And that's why we don't use any topical testosterone, because when you put topical testosterone, it's converted to DHT, about 70% in the blood.
Wow.
So you don't want DHT because DHT can't get into the brain. If you're looking at improving brain function, you need to have free testosterone. So it's the free testosterone.
So DHT is great for the muscles,
right,
but not for the brain.
So guys that are concerned about hair loss, and they're DHT sensitive, they should not use a topical.
Correct.
Absolutely not. But I thought it's just transient, that response.
No, it's the influence on the hair follicles over time. And what happens is, if you follow some of the new stuff in hair regeneration, it's the keratin plugs, or the fact that the skin on the scalp clogs the pores, and over time it causes the hair follicles to die, and that'll lead you to loss of hair.
Okay.
So interesting.
Let's move on to the next big contender.
Well, before we do this, I wanted to say something, because first, thank you for sharing with us that you had 6 traumatic brain injuries,
big time.
and that you experienced hormonal deficiency. You found a way to get yourself better.
Correct.
I like to do this with everybody who's on testosterone. What was your life before TRT? What's your life after?
Right.
So let's think before 1997.
Right.
Before you found you had this hormonal imbalance.
Right.
You were on antidepressants. Let's say you never found that you had a hormonal imbalance.
Right.
And you stayed at your state. Where would you be today?
I wouldn't be here. I wouldn't be here. I don't think I would be here. Not that I'd take my life, but I wouldn't be in this space of focus on helping other people.
This is the power of hormone replacement when done properly. This is why we love what we're doing, because we're changing lives.
And
I've
the identity
changed my
power.
life.
The
You
identity
change
power.
your life.
Yes.
We're changing patients' lives. This is the power of hormones,
For sure.
Correct.
right?
So, yeah, by the way, your brain is like, it's so hard to keep up with.
Listen, for
Like
full
if you go to
disclosure,
his lectures, oh my God, I don't know what type of cocaine citrate you have to take in order to stay focused, because it's you're really inspirational, man. For your age and how deep you can go with your thinking, it tells me that, hey, there is hope for people if they do the right things. Right.
every time I tell him, call, Doc, what should I take? Take this. I'm like, no, I don't want to take that. Let me drink your blood. That's what I want.
He's contragular now. Yes, I like that.